It is that time of the year again with the warm weather and the sun shining bright. It's time to think about sun safety.
That's right, even on these cooler days that we're experiencing.
That's right, but while we are enjoying that sun, let's keep skin cancer away. Nicole Samavilla joins us now with details.
1 in 5 people will develop skin cancer in their lifetime. It's up to all of us to look out for the signs.
Melanoma is one of the most common forms of skin cancer, and it's definitely the most deadly.
Moles should have a clean border, no more than 2 colors, diameter smaller than a pencil eraser, and perhaps the most important,
E is evolving, so changing in a mole.
But it's not just your skin you need to worry about.
The crazy thing is 10% of melanomas actually occur in the eyes.
Blurred vision and streaks through your eyes or your nails are signs of concern.
If the pigment goes beyond the nail, kind of into the bed of the finger, that can be concerning.
So how do we prevent it? Avoiding the sun, of course, something Ross knows isn't realistic.
Most patients I have are tan, they're on the beach, they're not gonna stop, and that's okay. Just wear sunscreen and make sure that you reapply it every 1 to 2 hours.
Melanoma peaks at age 40 or 50, but Ross sees many patients in their 20s.
With the increased use of tanning beds and people being out in the sun more, it's definitely happening younger and younger.
So make sure you're watching your moles and keeping up with skin checks.
And wear your sunglasses too.
Right.
And the sunglasses have to be protected. You can't just get them at the dollar store and think that you're going to get the same protection as you get with a good quality pair of sunglasses that actually blocks the sun's rays.
Right.
True. The nail one, that was interesting.
I know.
That's new to me too.
And we all look down at our nails at that time.
Yeah, I'm like,
interesting.
Yeah.
Well, melanoma is actually genetic, and if it does run in your family, you definitely need to be getting screened every year starting, they say, in your 20s.
It's very important. You do it once a year, right? Once or twice a year?
I wish that I could say that I did, but I don't. I
But
mean,
you've been to the dermatologist.
Right, I go to the dermatologist. I keep an eye on myself. So if there was something that I've definitely had cases where I ask them to take a look at it just to be sure.
Yeah, it's smart. It's smart to do that. I've had several of those precancerous things taken off, frozen off, burned off, whatever it takes. But if it's precancerous, they can catch it early and get rid of it. So and go every year. If you are in that particular zone where your family has had it and that genetics do play a role, don't waste any time. Just get to the doctor and be checked.
Pay attention to your skin.
When it comes to sun safety, the CDC, by the way, has some tips, and we mentioned these before, but they are worth repeating. First, they say that sunscreen should always have that SPF of at least 15. In most cases now they're saying 30.
Yeah. Now, it should also say broad spectrum on the label. Be sure to look for that. Experts say sunscreen should be reapplied every 2 hours or after swimming or even just sweating a lot.
And clothing can help protect the skin too, but don't be fooled if you think that you can go ahead and skip the sunscreen at the pool. A typical t-shirt has an SPF lower than 15, and a wet t-shirt offers even less protection, and that's why they say whenever you're applying your sunscreen, do it 15 minutes before you even head outside and spray yourself before you even put, or lotion yourself up before you even put that swimsuit on, so that you're getting underneath where even your swimsuit or your t-shirt would cover up, because you want to get everything.
Don't wait until you get there, because a lot of times people, I'll get a little bit of sun first and then I'll put it on.
Yeah.
And no, that's not smart.
We've all used that excuse before. It's
right, no, apply it before. Safer.
That's right.
There we go. Coming up.